I want to talk about something that's very important for my new nurses, and not this can be for new nurses and experienced nurses. All right. In the event you are at a facility and you are asked to do something that you have never done before and you don't feel comfortable, I encourage you to please do not do that task. All right. A few years ago, I was working at a facility doing agency work, and I was a supervisor, but this facility had a patient that I have not had to have the experience of ever having to deal with. And there were only two nurses in that facility that knew how to handle this procedure with this particular resident. So it was a weekend, of course, and what I did was call in the nurse who worked that unit and, ask her, to, hey, do you mind coming in so you can do some education? Not just for myself, but for the other nurses, that was there. And sometimes when you're put into that type of situation, you just do not want to move on something and not have any type of experience with it. Although it was in my scope of practice, okay, because the nurse who was doing it was an LPN. So it was definitely in my scope of practice, but just because something is in your scope of practice does not mean that you will feel comfortable, especially if you haven't been educated on that process. So I encourage you, when you do not know how to do something, and yes, of course, I did go to YouTube and watch the video, but again, it still wasn't enough information. The amount of supplies and everything that they were telling me that I had to gather to do this one procedure for this patient was still a bit overwhelming. And I kept thinking, like, oh my God, what if something goes wrong? I wouldn't know what to do. So I did not move forward. I did make the call and, call someone in who knew how to do that procedure and then educate myself. So then the next day I did know how to do it. But don't ever be scared to say no to a procedure. All right. One, I always say, always think safety first. Always protect your resident and then always protect yourself. Always protect your license that you have worked hard for. Okay. And as nurse leaders, I will encourage you, I can see if you were in an acute care setting and you're getting this patient in the ER or they getting moved up to your med surg unit, and you might not know exactly what's going on with this patient. But when you're working in a skilled nursing facility and nursing homes, we know exactly what's coming into our facilities. So we have to be proactive in making sure that as the leaders of those facilities, that our staff are educated on how to care for that patient particularly. And even if they are agency staff, just send, hey, an email to the agency, you know, and just say, hey, you know what, we got this new type of patient. Can they come in and get some education? Because, I see that they're working on the weekend, for this weekend. Because you want to make sure, again, that everybody who has to deal with that patient knows how to deal with that patient. So I wanted to send this as a reminder. Whether you're a new nurse or a seasoned nurse, in the event that you ever come across a situation where you do not feel comfortable completing that task, do not do it. I know it's in your scope of practice, but if you do not know how to do a procedure and that ends up in a negative outcome, we can't just say, well, they told me to do it. All right. You have to know your limitations also, and go to your charge nurse, go to your DON, your educator, and get educated on the steps that's necessary so that you can then care for that patient appropriately. All right, so that's what I wanted to share today, okay? Although things may be in our scope of practice, if we do not feel comfortable or we do not have any type of experience, we have not been trained with return demonstration and pass that competency, I will highly encourage you to not do that until you have been signed off on it. All right, that's my spill for today. Thank you.